This is Jerry Hesch of the Hesch Institute in Aurora, Colorado, and this is a guided meditation of the cervical spine and shoulder girdle. The purpose is to induce relaxation and hopefully increase one's awareness of that part of their body. You can continue to look at the picture for relaxation, and this is a picture, a copy of a painting of irises that we have in our hallway. I like the soft colors. Body parts can move along 3 axes. A front to back axis would allow you to bend sideways to the right and sideways to the left. So imagine an arrow pointing forward out of your belly and also pointing backwards, going out of your spine and extending beyond that. That is the anterior to posterior axis of movement. The body could also move forward on that axis, and it can also glide backwards. If there are 2 body parts acting along that axis, then they could compress together, and they could also distract, one going forward and one going back. These are fundamental concepts that are going to help you visualize parts of your body in 3-dimensional space. There is a left to right axis. So imagine an axis going through your body from the left side. If you extend your hand out sideways, lift up your arm sideways, straight out horizontal, the arm is parallel to the floor. Extend the other arm, and that can represent the axis that goes from the left to the right. So a body part moving about that axis would be bending forward and bending backwards. A body part could also glide to the left along that axis, and it could glide to the right. If there are 2 body parts interacting, then they can come together from the right to the midline and from the left to the midline. 2 body parts can also separate from each other and move out laterally, one going out to the right, the other going to the left. So that leaves us with one more axis, and we will apply this to the body part, and I think that you will find it an interesting way to image body parts in a very relaxing manner. At least for me, that is what I experience, and when I use this kind of a meditation, I find that I'm very relaxed afterwards, and I find that the region of the body that I'm working on is very relaxed afterwards, and it literally feels like it functions more efficiently. So the other axis is up and down. So if there was a line coming from the ceiling through the middle of my body all the way down through the floor and further down, that would be the vertical axis. So as that axis, if you will, pierces my body, then I can turn my body to the left, I can twist to the left, I can come back to neutral, I can then twist to the right and come back to neutral. Along that axis, I could glide up towards the ceiling, I could glide back down and go through the floor and go into the basement. If I have 2 body parts, one is on the ceiling, one is on the floor, then those body parts can come together. The top one coming down and the bottom one, of course, gliding up. We could also call that distraction and compression. So we're going to take these concepts and then we'll just add planes of the body. So the frontal plane, think of a sheet of glass representing an entire picture of your body, and you're standing behind that sheet of glass. So we're looking at your body from the front. We can see your face and the front of your body. That's called the frontal plane, and it's an anterior view. Standing behind your body, we're still looking at the frontal plane, but we're looking at it from behind. So that is a posterior to anterior view. You're looking from a posterior direction, looking forward. The second plane of the body is like a slice, as though you've taken that sheet of glass and turned it 90 degrees, and now it's slicing through the middle of your body, cutting the body in a right half and a left half. So image that plate of glass going through the whole body, front to back, and extending further outward. The last axis is a transverse plane. Imagine now that you're standing on a square sheet of glass. Imagine that it's arbitrarily 4 feet by 4 feet square. You can lift that plate of glass straight up towards the ceiling, going from floor to ceiling, and imagine that it can dissect your body anywhere along your body. So if we move that plane all the way up to my neck, and we then paint it, then looking down, you're not going to be able to see my lower body. You're not going to be able to see anything below my neck, but you'll see my head sitting above it. That is the transverse plane of the body. And if we were to look down onto my head, you could see me turn my head to the left, and you could see me turn my head to the right. Going back to the axis that goes front to back, called a sagittal axis, divides body in half. Looking at that axis, you're looking at the side of the body, so you can see movements such as forward bending and backward bending. Me looking down and then looking up. If you look at the frontal axis, the frontal plane, if you look at the frontal plane, then you can see me bend to the side, bend to the other side, step to the left, step to the right. And if I erroneously described a sagittal axis, then I'm going to back it up and talk about the sagittal plane, which is that plane that dissects your body. In between, right in the middle of the body, separating into a right and left side. So I'm simply moving the camera to another view of some colored glass and getting a little bit more quiet because there's a little bit of noise starting to happen in my house, this being early morning. So now we're going to take these concepts and take them to your head on your neck. So you can repeat the concept of this meditation after we describe the technique, and then you can take as much time as you need. Imaging your head sitting on your neck, I want you to image it lifting up off of your body. Does it move freely in your imagination? Now image it coming down into your neck. Now I want you to image your head gliding forward, straight forward, and then image it coming back, simply paying attention to the degree of imagination, the degree of imagined motion, the smoothness, the quality of imagined motion. Now image your head gliding straight back behind your body, and then bring it back slowly. Now image your head bending sideways to the right. Then image coming back to neutral and bending your head sideways to the left. Bring it back to neutral. And now image your head turning and looking over your left shoulder, slowly coming back to neutral. Now looking over your right shoulder, slowly coming back to neutral. Now image your head gliding sideways to the left. See how far it seems to go. See if you can discern a quality of the imagined movement. And then allow it to come back. So it's less of a directing it with your mind as it is getting movement started and then observing it. Almost as though that movement can happen independent of your thinking. It's a slight suspension of belief, but it's helpful in this perspective. When the head has glided back in alignment with your body, allow it to glide to the right, paying attention to the excursion, and then allowing it to slowly come back. Now image the head moving and looking downward. Slowly, it's going to come back. And now the head is going to move slowly, looking up. Observe how far it seems to go, and then allow it to come back to neutral. This is the process of moving body parts along the axes in each of the three planes. It's probably easiest for you to image it moving only along the axes. If you perceive that there is a reduction of movement in which it feels difficult or constrained, you can image gently pushing against the part. Image a hand pushing against the body part, giving it a little bit of energy, a little bit of physical energy. So someone's hand is gently pushing against your head in the direction in which motion appears to be constrained in this realm of imaging. The force is very gentle, so it might take time for it to engage. This is what is called potential energy. So if I were to push on your head very gently, it might take a little while before there is enough energy built up for your head to then start moving. So using this kind of imagining, observe the response to imaging a sustained pressure in the direction in which movement is constrained per your imagination, per your visualization. Maintain that force there for a little while, and then when it moves and seems to move in your mind smoothly and fully, allow it to come back to neutral. Take these principles and apply them in each direction. Of course, if movement is very free in your imagination, say left to right gliding, then there's no need to visualize a passive force through the body. Take the same concept and treat your neck as a whole. Now, instead of the head moving, we know the head moves with the neck, but now give your focus to the neck itself, covering top to bottom. Later on, as you develop skills with this meditation, you can then separate the neck into segments. There are 7 vertebrae in the neck, and each of them has a slightly different motion characteristic. For now, just work with the neck itself. When you finish going through this process with the neck, then go to the scapula. Image your scapula moving about all of these directions. When you're finished with the scapula, image the clavicle. It might help to glance at an anatomy picture of the shoulder girdle. When you're finished with the exercise on the clavicle, then do the same thing for the first rib. The first rib is shaped like a short C, and the front of it is dropped down behind the clavicle next to the sternum. The top of the rib connects with the first thoracic vertebrae higher up. So the rib lays down at about a 30-degree angle, the front of it being lower than the back. Go through the same exercise visualizing that rib, and you can then visualize other ribs, or you can visualize several ribs moving together at the same time. When you're finished with that, then visualize the shoulder joint. Visualize the top bone in the arm, the humerus, which has a rounded head, and it makes a joint with a little shallow cup that comes off of the front and lateral part of the scapula. It would be helpful to look at several images in an anatomy text to help you view it from the back, the top, the side, the front, maybe the bottom, etc. You can take this meditation and continue to different parts of the body, and then you can do functional linking. As an example, the first 4 to 6 ribs tend to work together as a group because the scapula, right next to those segments, moves, and the upper part of the thoracic spine tends to move. There are exceptions to everything, but you can cluster a few of these together, and you can experiment clustering just 2 together, or 3, or 4, etc. You can, of course, separate it and visualize one at a time. The same can be true with your hand and wrist. The wrist is comprised of a proximal row of carpal bones, meaning wrist bones. So there's one set of wrist bones, and then there's another set closer to the hand. So you could visualize the bones that connect the hand with the forearm moving as an entire group going through this experiment. You could visualize only the proximal row that attaches to the forearm. You could visualize only the distal row that attaches the proximal row to the hand. It makes a linkage. So I'm going to discontinue this meditation, and we are at almost 20 minutes. And again, it's an experiment in visualization with no promises made, no rules or regulations about how you, as a unique person with a unique body, are supposed to respond. Think of it as more of a relaxed process of discovery. I hope this is helpful to you. I hope you find greater relaxation and greater ease of movement and reduction of tension. Thank you very much.